So much of these conversations feels partisan, and it feels like if doctors had a bigger role, it's medical.
Men have that right, women should have that right. Why are we at a crisis moment?
Is the internet the best thing that ever happened or the worst?
It's the catastrophic event. The whole origin of medicine has been misogynistic.
How is it that men rule the world?
That has definitely been a huge issue of our time. We don't understand women's healthcare, and we're afraid of what we don't understand.
Why?
Hi, I'm Dr. Tara Shirazian, OBGYN, gynecologic surgeon, and the host of today's show, Health Starts With Her. So I'm so excited because we're here for our special at-home edition. We're here at my home. I'm joined today by Nicolle Wallace, political commentator, journalist, author, and podcast host of The Best People. And we'll be talking about all things women's health. We're talking about patient autonomy, access, standing up to power, and how power often shapes health decisions instead of medicine. This is a conversation that matters, and it starts right here.
Let's start with our origin story. So I meet you. I'm in the emergency room at Sinai, being rolled around rather frantically with an ovarian torsion that I developed because I was going through fertility treatments, and I guess I had like hopped up ovaries. And it was this like medical mystery. But if I thought that trying to treat my infertility was going to land me in an operating room, and thank God it was you operating on me, I don't know that I would have proceeded with what I was doing. Why is women's health such a choose your own adventure?
Yeah, well, first off, that was such a story.
It's insane.
That was such a moment. I actually still vividly remember that moment because it was, 20 years ago
Yeah.
now, right? It was a long time
ago
that we've known each other. And I just remember that you were running, you were jogging through Central
with my
Park.
dog. Yeah.
As all women do, right? On like a sunny weekend day.
Yeah.
And just all of a sudden had this excruciating
collapsed,
pain.
yeah.
And someone found you.
Well, so I collapsed, and a lot of people walked by me. And I'm there with my dog who's like licking my face, and someone got me up, and I lived at the time close to the park, so I like staggered home. And I think my doorman called my husband at the time and rushed me to the emergency room.
Yeah, I remember that because it was a scene. You were being like kind of moved quickly to the operating room, and you were like, "Just please save my ovary." I remember. I'm like, "Don't worry, that's what I do."
And tell my husband to walk my dog.
Right, and tell your husband.
Those were like the two last things I remember saying.
I mean, it is amazing how care differs so much for women wherever they are. You know, as you know, obviously I work here in New York City, but also I do global work. So the type of care varies so much. And I really don't think that women's care needs to be as enigmatic as it is. Yeah. But the problem is that no two people are the same. We are complex beings, right? Like, so there's just so many variables involved in any individual person's care. And I think
how
that's
do
where
women
we
get
miss
to the
boat.
point where they're, like, it seems in hindsight, like someone should have been keeping closer tabs on me before I ended up in that position on an operating room table.
Yeah, I think a lot of women feel that way. Like, why am I here right now? Like,
right.
What?
Like, why did we get to crisis?
Yeah. Why are we at a crisis moment? Well, to be fair, in that particular scenario with ovarian torsion, it is one of those very fast, very emergent, very freak kind of things. It's like an appendicitis would be, right? Like it happens all of a sudden, and you don't really have a lot of warning signs. You might have a cyst. That would be sort of the only one. Mm-hmm. And yeah, maybe someone should have taken note of that, or maybe, you know, women themselves can note like a growing kind of pressure or feeling that would indicate a cyst.
The backdrop, though, I think of a lot of what you do is, you said you practice in New York City, but you also work around the world. There's a real hierarchy, right? And privilege and means often suggest better care. Is that fair?
Not necessarily, ironically.
Okay,
but
explain.
I think, because sometimes I think if you have all the money in the world, right, and you go for care, you may also be told the things that sometimes people want you to hear, honestly. So there's this middle ground where you have access, which is highly important. And that access means that you have good doctors that listen to you, that think about what you need, that know you as an individual, and that work to your benefit, right? And don't think about other extraneous things like financial or, product or whatever else, right? So you need that really good team that's cognizant of what you need and is on your side. And that isn't necessarily bought by privilege, by the highest levels of privilege, but good care does mean access. So I think you definitely want to have good enough insurance, live in a city that has good enough doctors, or be able to access good enough doctors, that you have doctors that compete, maybe, you get multiple opinions. So I don't know if that answers it, but it's a little less black and white, I would say.
What is the most basic thing to secure for yourself as a woman, no matter where you are? If someone's listening that is outside of New York City and maybe doesn't, I think you're talking about these great hospital systems in New York, that compete for the most brilliant doctors, and so that's the competition. But if you live in a place where there's one hospital system, and so you're not going to go shopping around, what's the most important sort of gateway to knowing you're in good hands?
Yeah, I think that for women, they have an intuition about whether they're being heard and whether their questions are being answered. So I think that if you feel comfortable with your doctor and you think that that person is trying to do the best for you and getting you to the services that you need and working on your behalf, then you are probably accurate. Like, you're probably right if you feel like you're being seen and heard. But the thing that I think people can add to that is really knowing the landscape of care. And this is where social media, the internet, shows like this come in, right?
Is the internet the best thing that ever happened or the worst?
I love how it's all black and white, right? Like, it's either the best or the worst. Well, there's many things that I don't like about social media and the internet. And I can tell you it's because they try and boil everything down to a soundbite.
Or a diagnosis.
Right.
How many people call you and they're like, I have what?
Right.
And you're like, well, let's check that out. I'm like that. I can catastrophize. And at least I can get in when I'm having a panic attack about something I've self-diagnosed on the internet.
Yeah.
How much anxiety is unnecessary?
There's a lot of that. So yes, that is where the internet is not good. It's not good because you read something for like 15 seconds and you think you have it. And you think it's the worst thing in the world. And if you put it into Google, they tell you, usually it's the big C word, whatever it is that you're looking
for. Yeah, any body part that you Google, you get to, like, algorithmically, you come to a cancer diagnosis.
You come to cancer. And
how often is that the fact?
Very rarely. It's the worst case scenario, but most things that are common are going to be benign. Cancer is still relatively uncommon.
But in the internet, it is always the explanation.
It's always the explanation because it's the worst case scenario. Yeah. Like you said, it's the catastrophic event. So that's the road it's gonna lead you down. But the way that I think the internet can sometimes work in your favor is all of a sudden you realize that the landscape of diagnoses is broader than you thought. Mm-hmm. Like, oh, my pelvic pain could be fibroids, or it could be an ovarian cyst, or it could be endometriosis. Like, I think the places on the internet that help you understand that it's broader than you thought is very helpful.
And stories. Like, I think with some of this stuff, you look, like, the bottom line for a woman, everything below the belt is shrouded in shame, right? Any symptom is a shame story for most women, whether it's infertility, whether it's painful periods, whether it's pain during, and whatever it is, there's there's a medical story and there's a shame story. So how is that its own set of hurt? And that's to say nothing of the political shame. Right? Any procedure women pursue, from infertility to reproductive health to menopause health, is historically and currently shrouded in some political controversy.
100%.
Why
100%.
is that?
Oh, that I think dates back so long that, historically, just the whole origin of medicine has been misogynistic in terms of the origin, right? Like the ways in which women's health was understood is through the eyes of men and through really diagnoses that were for men, mostly. So even women's body parts were not well understood. Even the function of the vulva or the clitoris were not well understood, right? So if you don't understand the function of the normal female body, and you don't have words for it, and you don't have understanding and even diagrams for it, by the way, no, they had no pictures of like the vulva and the clitoris until, like, I don't want to misquote the date, but it was late. It may be late 1800s, early 1900s. There weren't even images. So people did not understand women's health care. Origin of it was not delineated for anyone. So I think that the problem is when you don't have a basic understanding of what's normal, how are you going to understand what's not normal? So that's the first problem, right? And then women themselves were constantly being told that whatever they were feeling was hysterical, was overly dramatic, was not true. They couldn't be in pain like that. That's just part of being a woman. You're just feeling normal woman pain. And they're still told that to this day. So that has not really changed either. So I think, we don't understand women's healthcare, and we're afraid of what we don't understand.
Why?
Because it gives women more power, more agency, more ability to feel good. If we were out of
pain, if we were at the starting line at the same place. Yeah.
We'd be unstoppable because we already are. So, there's probably a huge element of that.
So I, like you, have a son and a daughter, and one of our favorite jokes in the house is, how is it that men rule the world? Because girls are so logical. Like from birth, they come out somehow able to have conversations and tie their shoes, and men will still throw something against the wall, whether it will break or not, right? They have such different sensory needs, and there's such a and you see it at a very young age, how men are boisterous and rewarded for being so, and women are logical and rewarded for being so. How much of this is nature and how much is nurture?
There definitely are differences in how I think male and female brains approach issues, right? And also there's individual differences, some males are more sensitive, some females are more sensitive. So you're going to have a lot of variation just in terms of genetic sex. And then, of course, we get into the whole idea of now there's the trans community. And so what is actually biological and what is actually nurture? But just to deal with the nurture piece, I would say we instill certain values in our children, right? We help them understand what they're capable of. The world helps them understand, not only the parents, but also their friends and their communities and their schools. So if we are from a very young age telling, let's say, our girls that they need to perform, they need to listen, they need to be a certain way and fulfill certain characteristics, then they grow up thinking those things are accurate. And I think right now, social media has a lot to say about that, which is wonderful, right? There's more representation, but there can't be enough of that. I mean, I think girls grow up thinking that they have to be quiet, they have to be pleasing. Pleasing is a very key characteristic of women.
And it seems to make its way all the way through all the healthcare stuff. So let's go down there and do through life, and then pull me off every time we come to a political hotspot, which seems like everywhere.
Everywhere.
I mean, obviously,
at every turn.
Every turn.
Basically.
I mean, obviously, I cover the historic Supreme Court decision, Dobbs, severely limiting women's access to reproductive health care. How does that enter into your practice?
I mean, that is huge, because a woman's right to her own body and to be able to make decisions about her health care and her body is a very important key power that women should have, right? Like, you need to be able to make agency. Yeah. You need to be able to make decisions for yourself that are in your best interests, right? Especially when we're saying, so that's pregnancy specific, but we're telling women that they should do that at every point in their lives. So how can we rob them of that, during their reproductive years and during the time when they want to be pregnant or don't want to be pregnant? And so, I've seen women in the last, 7 years that I've been a GYN choose to remove their fallopian tubes more than any other. Young women, early 20s.
Like
sterilization. Removing their tubes. They never want to get pregnant. They never want to be in a situation where they could potentially get pregnant.
And not have a choice.
That's incredible. So I have seen that more than I've ever seen it in my entire career. And it's really young women. It's early 20s. It's women who are saying, I'm making the choice now. I don't want to be in the position of being sick and in the emergency department, losing my life. Like, I don't even want a kid. Why would I bring a child into this world? I hear all of these themes from very young women. And, and even they say, well, what if I leave New York? What if I decide I want to move to another state? What if I decide I want to move globally? Because we do have a lot of long-acting contraceptives as well, like IUDs, but this group is not even choosing the IUDs. They're saying we don't want to run any risk.
Because they've come of age at a point when abortion has been such a hot button.
Right. And I believe in women's choice and agency, so I support them in whatever those decisions are. I truly believe that it's my job to counsel and educate and lay out the options for you, not for me to make the decision for you.
Right.
And sometimes in the office, it's interesting, like I'll have a patient come in and they really want me to make the decision.
Or to challenge them.
And they're like, well, what should I pick? What do you want me to pick? My cat has joined us.
I'm glad. I'm so glad. This is a conversation for everyone.
She's a female too.
Beautiful.
So.
I know all my pets are women. I have two, not women. They're two female dogs.
And she's highly social.
So. She's perfect. She's perfect.
So, I think that is an important, as you said, coming of age issue for young women.
Is that regional? I mean, because
probably.
I think after Dobbs, there was a sense like I'll be okay in New York, but I heard a story, I covered a story of a woman who was pregnant and on a business trip and was in an accident in another state and had difficult access, not to reproductive care, but just to being treated because the hospital didn't want to touch her because she was pregnant.
Highly regional, right? We're right now very privileged in that regard here in New York, but a lot of states, they're not seeing pregnant women. They're turning them away at the door, no matter how sick, no matter how acute, no matter how emergent their care. Yeah. And it's just traumatizing, the things that women go through. It's really, it's overwhelming how horrible the care is in some places. So I think that has definitely been a huge issue of our time. And it is just sort of, it's one piece of the spectrum of women's healthcare, maybe arguably the most important piece, right? You need agency over your body, agency to decide for a pregnancy, maybe even more than any other health issue. But every health issue faces that same sort of tug of war. Like, do you get to decide or do I decide for you? I think that's sort of this tug.
So even in our adult lives, this feels to be a space that's gotten worse.
Yes.
Where we can't look at young women and say, it's going to be better for you. It's going to, like, as difficult as it was to navigate these things when we were in our teens and 20s, it's more difficult now. What does that say about us as a country that we seem to be moving backwards?
Well, it's very, very troubling, obviously, but I think the thing that I'm learning is we cannot take anything for granted, right? And we need to be constantly lobbying for our rights and for our healthcare rights specifically too. And nothing is a given, right? We're not going to automatically be able to keep and continue in the ways in which maybe we've had some freedom. So we need to make very, very certain that collectively as a group, we work together to get our healthcare needs met and to make sure that they're safe against change.
But do you think that, I mean, so much of these conversations feels partisan, and it feels like if doctors had a bigger role, it's medical.
Right. It is medical. This is just pure medicine, honestly. Like a woman's right to have choices over her own body is
especially
completely
if she's
medical.
Sick or in crisis, doesn't
100%. Even when she's not. Like, that right is not automatically given to women. That is sort of what we're saying, right? But men have that right. Women should have that right. It's the same, right? And you are in the best position to make decisions over your body. No one else should be making those decisions for you.
Like covering politics, I've often felt like if men got pregnant, if men carried a watermelon inside their uterus right above their bladder that kicked them in the ribs and then had to deliver them through their, most sensitive private parts.
Right.
Like the Supreme Court would have voted 9-0 that men can do whatever they damn well please
right.
at any stage of that process.
100%.
Where does sort of our history of getting to women's bodies and women's health, second, third, fourth, fifth, and last, play into this idea that men can make any choices about a woman's body?
Right. That is why women have no power and control, because the people in charge, which are mostly men. But by the way, we should talk about women and also the importance that they play in forming community and fighting for these rights too, right? But I think definitely the men in charge have restricted access, have reduced women's autonomy and women's power, and that is 100% on purpose. So
it's interesting though, like if you look at the polls, they're not particularly divisive issues. I mean, you've got like great majorities and pluralities who oppose the way the Supreme Court decided Dobbs. You've got great majorities who oppose restrictions where a woman's life is, I mean, it's not like a 50-50 issue when it comes to access to reproductive care, but yet our politics swing against those interests.
Right. The only thing I can say about that is that, it's for the optics, right, of political marketing, maybe. Yeah. It's sort of like the optics of what you stand for, and to be out in the news. I mean, you know this so much better than I do, but you have to be divisive, right? Mm-hmm. Like you have to be one side or the other side, or no one will listen, I guess. I don't know. But
I think also when access to IVF came in, it became even more popular to support a woman's right, and yet we had an outcome that swung it in the other direction. Can you just talk about how access to IVF is also in peril when you reduce women's choices and options and access to care?
Right. Well, when women don't have the ability to decide, right, again, whether to be pregnant, whether to not be pregnant, whether to have a pregnancy that is not going to be as viable or as good a pregnancy chromosomally, safe pregnancy. If they don't have that right, then through IVF, obviously they're not going to have that same access either. They're not going to be able to do the things that will lead them to good health and healthy pregnancies. So in many ways, we're talking about how women aren't getting pregnant these days, right? Like that's one of the big complaints right now. The fertility rates are down. No one is wanting to get pregnant, but then in the same turn, we are restricting the access to abortion care and access to IVF care, like healthy pregnancies. So which is it?
Right.
Like if you're going to support women, you want more women getting pregnant, you want population growth,
right,
then you're going to support the things that help them grow their families.
This was one of those like touching the stove issues for the right in our country, in states and nationally, where they realized that everyone supports access to IVF because, like you're saying, if someone wants to grow their family, they should have access to this incredible science, which made it possible for, I used IVF, I relied on IVF, and a lot of people do. But I wonder if you think that it's just once someone says it out loud, you realize there's a community that isn't wrapped up in right-left politics, that anyone that's benefited from IVF sees each other through partisan lines? Or what's the way out of this moment?
I think a lot of this is about control for control's sake.
Yeah.
Right? It's about denial of care and services because I can.
Right.
And the problem with that is there's no rational reason for why these things should be denied. And our goal, I think, is to help all, at least for me, because I do women's healthcare, women understand what's going on, right?
Yeah.
Like, you need to understand the role you play in terms of making sure we have safe choices, in terms of building up community, in terms of supporting other women.
Because a lot of people, and I hear this, well, whether I'm interviewing someone in sports or entertainment, well, I'm not political. It doesn't affect me. I mean, your point is like, once you're in your exam room, it affects everybody.
It affects everyone. It affects literally every single woman, because even if you don't plan to have an abortion, an IVF pregnancy, or whatever, you still will have some health issue over your lifetime. Right. You'll have maybe fibroids, because 80% of all women have fibroids. Maybe you'll have breast cancer, because 1 in 8 women have breast cancer. You're definitely going to have menopause, and that affects, half of the population at any given time, right? So if you're definitely men who love us, right? So you're going to have one of these health issues.
Yeah.
So if you want the playing field, you want the access, you want the choices, you want the autonomy, you want what goes along with having freedom of women's health care, then you should be voting for all of it.
What is it about this period that gets so much attention? When, like, to your point, every single woman is going to go through menopause. Every single woman should have access to breast cancer screening, but every kind of cancer screening.
I mean, named the most common.
Right. How do we sort of take it out of the political arena? I mean, is that up to sort of cities and states to make it? Because it feels like in our communities, there's less of this, right? There's less charged conversations. Like, everyone wants their mom, their daughter, their sister to have access to a mammogram, and it feels like women's health, as you get farther away from national politics, can feel less politically charged.
Yeah.
Is that right?
Yeah, I think that's right. I think we don't see it, well, I think obviously we think of healthcare in general as a right.
Yeah.
Right? So when you think of it as a right, you expect that you will just receive it, But I think what we're seeing right now is, no, we have to fight for those rights too.
Right.
Those rights could just be taken away for the sake of taking it away. Not because it's the right thing to do, not because there's a reason that it should be taken away, but rather because someone in power, right, whether it be the president, the government, what have you, feels that that's not a right women should have.
So I have a thing where, and maybe it's because I'm of the age where I've seen things go the other direction, where I'm becoming radicalized. I only want women doctors. I mean, where do you come down on that?
Yeah, it's hard for me.
and I should say, I mean, Nathan Fox was my OB. Yeah. I've had great male doctors, and I had a great IVF doctor in Jamie Griffith. Yeah. I mean, like, I don't want to cut out of like my own story the wonderful male doctors, but as I become more aware of the politics around this, I feel more gravitational pull to women doctors.
Yes. Well, I'm a women's health doctor and a woman, so I'm totally biased. But I do think that some of what we're seeing is also who is out on the forefront talking about women's health issues, right? It is usually other women, a few of them, not a ton of people, but the people who are on social media, at least that I see, do tend to be female leaders, right? So I think that's wonderful, but I think that automatically makes us feel like, well, the people who are willing to fight for it are going to be the other females. Mm-hmm. I personally know some amazing, like you said, male physicians, but sometimes they don't feel maybe as invigorated as
mad.
we do, or angry.
Like being angry.
Yeah, it's angry. It's anger. It's not wanting to stand for it. It's sort of reaching a certain place in your career and life where you're like, this is not okay. I've spent my life fighting for these things.
Are you angry?
Yeah, very angry. I'm almost always angry, to tell you the truth. I'm angry literally every day.
Me too, and I thought it was the menopause. But
it might be.
It might be the
No,
moment.
I'm not even going to blame this on menopause.
Yeah.
I really think it's specific to our time. It's like the rights and the care and the thoughtfulness that we thought were just basic humanity, right? That we thought was just basic rights are in jeopardy. Literally, we see it in jeopardy every day.
I think the piece too that's hard to get your brain around is that, and I covered these stories leading up to the last presidential election, how many women have to die seeking reproductive health care for the country to say, no one's mother, daughter, sister, wife should die.
Right. I mean, I think unfortunately, like that boat has already kind of come and sailed away. Like I think we've already lost enough women to have made that point. And nothing has changed.
Why?
Nothing has changed because people do not feel motivated by that issue. That is not an issue that affects them personally, and there's not enough.
But it could affect anybody. Anyone married to a woman or
but for whatever reason, people don't feel themselves, right? I mean, they don't feel themselves energized by that.
Every story I see of a woman denied health care when she's pregnant and septic, or I covered all of the stories of the women in Texas who had to get gravely ill before they could get health care. And I saw myself in every one of them because I had such a complicated fertility journey, and I don't know who couldn't.
Right. Well, I will tell you, the global setting of that is that, and we've talked about this before, like there's literally around the globe a war on women. It's a war on women's lives. Like women die in pregnancy in some places, at even much higher rates than they do here in the US. And pregnancy is seen often as sometimes even a death sentence for some women.
Have our rates gone up? I mean,
oh yeah. Our rates are very high.
Take me through the history of that.
Well, so
when was it safest, and where is it now?
Yeah, I will say it was probably safest, when we had abortion care, right? Because abortion care actually saves women's lives. So we know that
one of the
to be
reasons
true.
you go in.
It's one of the reasons because an ectopic pregnancy is one of the top few causes of death. So to be able to have access to abortion care really does save women. And there's lots of studies on this around the world, which is why many governments actually argue for this type of care for women. And many governments have gone the other way and have allowed it because their maternal mortality rates were so high. So
we don't care about our maternal mortality rate in the same way that other countries do? That's going in that different direction?
Well, I think of the countries that are classified as developed or have higher GDPs, right? We rank very high in terms of countries like us in terms of maternal mortality rate. I think we're number like 35 out of the countries that, have good access to care and have higher incomes in general. So compared to countries where there's few doctors and fewer hospitals and fewer access, we do better, but we are very poor compared to other countries like us. So our rates have continuously climbed in the last 20 years now.
That's incredible.
Yeah.
That's incredible.
So I think...
Has that changed your focus as someone who does global women's health?
I mean, our focus globally is always on family planning because we can get that done for the masses in much safer, faster, better ways. Many countries don't allow abortion care where we work, so there's that issue many places where we are. Agency, yeah. But it used to be when I would go, let's say, to Kenya and do work, the teams there would be so impressed. Like they were like, oh, well, you're in the US, you guys have everything, you have access, to everything. And in the last 5 to 7 years, when I go there, like, oh my God, we feel so bad for you guys. Like, you're even worse off than we are.
It's incredible.
Because you used to have it and now you don't. It's very different. It's sort of like you had the access, but then it was taken away from you. It's almost worse.
That's incredible. Let's talk about my algorithm. I am hostage to menopause content.
As am I.
And I guess you kind of think you're going to know when it's coming, but I feel like even really informed people with access to wonderful physicians can miss it. And I was like in a puddle of sweat before I realized I was in perimenopause. Yeah. Just talk about menopause itself, and then talk about all of the bombardment of information and content.
Yeah. Well, so the one thing that I really love right now is that menopause is having a moment. It's
having like the Queen's Jubilee of moments. It's
Queen's
everywhere.
Jubilee. It's the only women's healthcare issue that we hear about now.
Yeah.
Which, I mean, on the one hand, I think it's great we're talking about menopause. Believe me, more talk is better. I love female leaders out there leading the charge. I think that's wonderful. But on the flip side, I'm like, we need to be using this momentum to talk about all things women's health. We need to bring along all of the women's health topics. And that's why I'm doing this, because I feel like this is an opportunity to help educate along all healthcare lines, right? So the thing about menopause, again, like everything in women's healthcare, is that it's highly nuanced, right? It depends on the individual. It depends on just personally what symptoms she feels, how she internalizes those symptoms, and what happens in her life because of perimenopause and menopause. So I think you do need a discussion with your physician. You need to understand you can have one of many symptoms, and then you need to be able to access care and actually get some treatments or some options for treatments. It is a very unique time because more women than ever are getting HRT, which I'm very excited about.
What's that?
HRT is hormone replacement therapy. And so it's estrogen and progesterone in combination, and there are many different formulations. It can be in the form of a patch, a pill, it can be gel. We have many types of HRT. And so the supplementation.
It feels like choose your own adventure again, though. It's like, I mean, I feel like with women, it's like you have to have a PhD in womanhood to even navigate your own whatever milestone it is, whether it's infertility, whether it's pregnancy, whether it's
menopause. You know what it is? It's trial and error.
Yeah.
Which I think many women feel like, why do I have to be like a guinea pig to figure out which is going to work the best, right? It's that trial and error feeling. And I've done it myself, so I know.
No, me too.
Just try it. How do I feel?
Let me ask you about this piece, though, about it, because I think for a lot of women, like hot flash is one thing, and it's a physical symptom. But so much of this can be mental health.
Yes.
Can you talk about how so many mental health symptoms, especially in women, masquerade as the kinds of things that we can just take on as what we presume to be the stresses of especially working motherhood?
Right. So I think what happens is we sort of get into this steady state, hopefully. Most people feel like at some point in their lives they're in this steady state. They're just doing their own thing. They feel good. They figured out a formula to get their work-life balance together, right? They figured out...
Which still looks like nothing like men, right? So they're like taking care of kids. They're like crushing it at work. They're staying in touch with their aging parents.
Yeah.
They're managing their home. They've got the dog walks. Groceries are available online. Thank God. So that's right. So like steady state is still like
steady state
adrenal
is still crazy.
Overload.
Right.
You can't take 15 minutes off. Every like moment between jobs is either spent ordering things online or, planning the week. I mean, it's still insanity. But yes, it's steady state insanity.
I'm going to call it steady state. Okay. So you figured out whatever algorithm there is, whatever formula there is, and you're just kind of cruising along. You're barely making it all work, but somehow you've pulled it all together for now. And then enter perimenopause, right? And then all of a sudden, everything that you thought you knew to help yourself feel good and get through the day is now completely in disarray. You can't sleep, you can't wake up, you don't have energy to get your day work.
People used to tolerate and rage you.
Right? You feel mad at everyone. You're screaming at everyone, the kids, the partner, everybody. So that steady state has now been disrupted, and you are frantically trying to get back to the steady state, right? And your mental health is suffering. I mean, your mental health was probably already suffering because of that continuous workload that you were internalizing that was a constant stress on you every single day, right? So it then throws off the mental health piece, and women feel more anxious. Also, by the way, perimenopause itself it creates anxiety, creates feelings of anxiety because of the fluctuation in hormones. So you just think it's you feeling worse because you're stressed, which
is rational.
Yeah.
And so you miss some of that because you're like, well, of course I'm stressed. I've got all this stuff going on.
Yeah, I mean, look how crazy look how crazy life is.
Right.
Like, of course I'm stressed. Of course I'm anxious. So I don't think it's unusual that women don't think that could be the case, right? I think it makes sense that you would just think you're very stressed right now. But we never know what we don't know.
Right.
You don't know what you don't know. So now enter, and this is where social media and the internet can kind of come in. Now enter all these voices telling you, oh, well, if you're between the ages of 45, it's like you're like watching a commercial. If you're between the ages of 45 and 55.
I always take all those quizzes and I'm like, I check all the boxes. But you can check all the boxes for anything. Like I think in the middle of covering the campaign, I checked all the boxes for some bipolar prescription medicine. I was like, oh no. I mean, but yeah, you get all this content.
You get this content. It's like if you're between the ages of 45 and 55 and you're experiencing lack of sleep, anxiety, hot flashes, you could be entering perimenopause, right, and you should take HRT, right? So now more than ever, more women are seeking out HRT, which I think is a good thing.
But if they call you, what are like the actual medical questions to know if this is the right thing for you? Is it a blood test? Is it symptoms?
Not necessarily a blood test. I think that symptoms alone are enough. Okay. And I do think that the degree of symptoms is like dramatic for some women, and I think most women deserve to be able to try it. Right. So I think historically what's happened is women have been kept from it, right? And we can again talk about like 30 years ago when the WHI was
and why was that? Because there was
big study was just basically misinterpreted to the public. Why that was, we can argue, again, maybe because they wanted to keep women from the medication, let's say, but it was misrepresented, and many women then did not start HRT. Because again, in the scheme of the internet, it's always about trying to boil down things to like a 20-second plug. So it became back then HRT equals breast cancer, mm-hmm, which is simply not true. Mm-hmm. It's not true. It was never true. So I think that in certain high-risk groups and in certain women who've had histories, you might want to be careful, but they are the exception. Right. It's a rare number that can't use it. There are some, but not that many.
And then how did it get so, I don't know if this is the right word, but it's like got this swanky feel. And like what you're saying is that everybody could benefit from HRT.
Everybody can get. So what we're seeing now a little bit, which I really don't love, is this idea that you need to somehow subscribe to kind of fancy physicians or online groups or communities to be able to access HRT, to really be getting good care for your perimenopause. You need to pay out of pocket to do it, or you need to enroll in these plans.
It's like almost intermixed with the longevity algorithms. Right? Whatever that is.
Oh my God, I can't.
But right? I mean, that's,
yes.
I mean, it's like, it is. Like, it's like bougie healthcare when like our annual, you swipe through all the, I mean, like it's, and I mean, I think it's a good thing that that's not the case, but how did it get so mixed up in this sort of elite content?
Because unfortunately, everything in medicine is also like, driven financially, driven by product, driven by.
But like HRT is HRT, and you don't have to get like the fancy.
You don't. HRT is HRT. I would encourage women to go to their regular GYN to try it, or maybe even some primary cares feel comfortable, and to give it a try for a few months. If you don't have a contraindication to using it, giving it a try and seeing if it makes you feel good and live your life well is definitely worth it. And I think, yes, to answer that question, there is this trend towards sort of this elitist healthcare world where, if you really want to be taking good care of yourself, you're going to believe in longevity practices and medications and hormone replacement gurus.
I get all the messages about, morning sunlight to reset your circadian rhythm, and electrolytes before you take a sip of coffee. And, like the HRT is part of this like really strict regimen, and it won't work unless you do all the things.
Right.
And that just feels like, yes, it's wonderful. I mean, I think if you live in the city, you have to get your kids to school, you're out there, doing a lot of those things anyway. And a lot of people are doing those things, but it does feel like it's been inserted into this wellness regimen that can be inaccessible.
What does longevity mean?
I don't even know.
When did that even become?
Surviving perimenopause.
I guess. I mean,
what is it? I mean, what does it mean to a doctor?
It's not a medical term.
Yeah.
Like, it is a term.
Is it a marketing term?
It's a marketing term.
Yeah.
I think it's a marketing term. Like, it's been coined.
I know all my doctors are really,
who,
really sort of, I've asked about those, I mean, and I guess it says something about my algorithms or my age that I see these, like you go into the MRIs and it's like, I guess if something's wrong with you, what is all that about? Is that about our anxiety?
A whole body MRI? Yeah. It's about access because you have access, right? Yeah. It's about telling you, it's about feeding you a vision of the world, a vision of your life and health. Because to tell you the truth, health is the most important thing in our lives, right? Yeah. If you're not in good health, you can't do the other things. So health is legitimately the most important thing, in my opinion. Because without health, you can't have wealth and freedom and, do the things that you want to do in life. So people are afraid. And so they're preying on fear, right? So everybody wants to live a long life. That's what longevity means, right? Yeah, we all want to live a long life.
Yeah.
But taking these specific supplements or peptides or whatever it is that they're selling me, I don't even know. There's no data.
Is it a vitamin or a shot, or what is it?
I think it's both. I've seen it both in like shot form and vitamin form. And again, there's no medicine that kind of is behind it. A lot of the supplements and the vitamins, they don't have a process for making sure that they're even what they say they are. So there's no process that supplements and vitamins go through in the US to gain formal approval. So we don't really know except what the manufacturers are telling you.
Like, are there some that you should take? I mean, like
probably
when I'm sick,
ones.
I rifle through and take like the stale vitamin C.
I think zinc is pretty good when you're sick. I think that one is really good.
Yeah.
I think vitamin D is really good.
Yeah.
There's a lot of good data on vitamin D. I think creatine maybe, there are some that have some data behind them. Right. And I think those probably are worth taking. Right. But the vast majority of them are just going to be broken down and excreted, right? Like, you're not going to actually absorb a lot of the stuff that people are trying to sell you. But I, like you, I'm on social, right? And the thing that I find the most problematic is I'm exhausted. I'm like seriously exhausted by everyone telling me what I should be taking. Yeah. That's what makes me
it makes me take
the most
nothing.
Tired.
It makes me take nothing because I'm like, it's so much. And if I don't take all that, so I end up like, well, I don't know. I missed this boat. I'm not going to do any of this.
But I feel like if you're in that perimenopause to menopause algorithm, it's like you need to be doing certain things. And there's lots of people out there telling you what you need to be doing.
Okay, so what did I not ask you about that you got in your practice or in your life?
No, I think we covered everything so much. This
Good.
was really so great. Thank you so much for coming.
To be
You're
continued.
amazing. To be continued, because there's so much to talk about at all times. But I
just love to make
really
a sweater.
love
I'm
seeing
mad
you.
all the time.
I'm mad all the time. I wish I could say that wasn't the case, but I'm mad all the time. And I get mad, and then I tell my husband, and he's like, okay, well, what should we do about this?
I know, because we have good ones. I know.
I'm going to rant some more right now. That's what I'm going to do.
That's really good.
And we're going to do these shows and talk about it some more.
Anytime. That's all we've got. Community. I mean, I guess that's
Community,
the last thing.
yes.
I guess that's the last thing. Like, I feel like as I have gotten older, like I can get all the steps down, but if I don't have like the laugh till you cry and all my like mom friend texts, like I used to be more judgmental of my son texting his friends all the time, but now I realize how important that is. That in some ways it's like that connection is everything. And now I'm texting with sending around the articles and sending. Like it feels 100%. Like it's everything. Like
it's
the community.
Everything. Community is everything, and we need more community. We need more women's communities, like I was saying before, and that is how we change, I think, politics. The other thing, actually, I really wanted to say, because I knew I was going to have you on, and one of the questions is, what can we do to our day-to-day? I was thinking about this the other day, and I feel like the other thing we can do is at whatever level we're at, right? So let's say we work in a company, or we work in a hospital, we work in a school. We make sure we promote the types of people that we think are going to be good and effective leaders in the world, because you never know when someone then goes to the next position of leadership where that will ultimately take them. So be
I say
very
this all the
careful.
time. I say this I'm like, be nice to her. We're all going to work for her.
We're all going to
work
work for her.
And I say this about all the brilliant young men and women.
But
like
the reverse,
she could run the company.
but I mean the reverse also. Like if you think someone is narcissistic, is not listening, is not community building, is not exemplifying the types of traits that you think make a good leader, kindness, thoughtfulness. Those are the people we should be promoting at every level. So then in a year from now, they don't become people that wield a lot of power and control. So I think that is something we can be vigilant for at every level.
Like take the good seeds and pour water on them.
But also weed out the bad ones.
And weed out
I
the
actually
bad
think
seeds.
More the opposite.
Weeding
More
out
weed out the bad ones.
Yeah.
Because I think sometimes the bad ones are allowed to perpetuate.
Because the systems are broken.
Maybe.
You're the best.
Women's health care isn't about headlines. It's about showing up every day and learning about your health. This healthcare shows up in exam rooms every day, and we're focused on bringing you evidence-based care and answers to all your questions so that you are heard. Health Starts With Her is a community. It's more than just a show. And we hope that you'll stay connected with us, tune in for episodes, and let us know what topics you want to hear. Thank you for being part of our community, and we hope to give you so many more great episodes in women's health.